Hi, everyone. Thank you so much for being here tonight. I want to start today with our discussion topic, which is how we can better advocate for and support healthcare professionals, especially in our current challenging environment. And I want to get right into it. Todd, I'm going to start with you. So 5 years after the pandemic, mental health problems are worse than ever. Half of physicians and nurses report being burned out. Healthcare workers face a 32% higher risk of suicide. You work across policy and advocacy. Can you describe the current state of burnout with healthcare providers?
Sure. Actually, no. Farida can, because Farida is an incredible nurse. But what I can say is that, you linked it to COVID, and that makes sense. I think that people don't realize there's a silent crisis in this country. People take for granted healthcare. They assume that they will always be able to go to a healthcare professional when they are in need. And people like Farida spend their entire life protecting the rest of us. And we talk a lot in our country about protectionism. We protect the oil and gas industry. We protect car dealers. How about protecting the people that protect the rest of us? There's none of that. And these issues didn't start with COVID. They started long before, and that exacerbated everything. And that's what we hear from our community at FIGS all the time. And they want to be seen, they want to be heard, and they want change.
Great, thank you. Farida, to you next.
Hello.
You're a nurse.
Yes.
And you have experienced the mental toll of being in situations where you're unable to help a patient because of a lack of resources, I'm sure. How does that make you feel? How do you deal with not just the professional implications, but how it emotionally makes you feel and how it affects your mental health?
I feel like we're in this position, for me, feeling called to be here as a nurse, and I've been a caregiver since I was a kid. I took care of my grandparents. So sometimes it's not like it's a choice to be here. It feels more like a calling. So being in a position where resources are very scant and I'm really fighting tooth and nail to provide the best care for patients, sometimes it feels like a lose-lose game. And I remember my very first job out of college. I was excited, energetic. I got to the hospital, and the motto, the slogan was, "The needs of the patient comes first." And at that point, it meant, sure, let's do it. Why not? But now, almost a decade in, I'm like, how harmful was that message? Because how am I supposed to put someone else's needs before my own? Putting someone else's oxygen mask on before my own. It's a lose-lose game at that point.
So how do you work through that? How do you put on your own oxygen mask first?
That's loaded. I think
Tough question.
We're still figuring that out. But I am grateful that these conversations are being brought to life right now. And we have organizations like Dr. Lorna Breen's Foundation, may her soul rest in peace, and may the many, many souls that we've lost due to deaths by suicide in this profession, may they all rest peacefully. But this is why we do this. This is why we speak on these matters, so that we don't lose any more and that we get the resources that we need to be able to care for ourselves first before putting the needs of our patients also next to that.
Right. It's an important message, and it's why we're all here. Corey, I want to go to you next. There's a lot of factors that contribute to burnout, right? There's a lack of resourcing in staffing. We have ERs that are overcrowded. We have equipment shortages. We have hospital shortages across the country. How does this under-resourcing directly impact providers?
There are at least two kind of categories of the way that we think about what contributes to burnout. And what I want you to think about when I answer this is burnout symptoms manifest in the individual, but they actually, or they come from the system itself. And so when we think about how we need to address it and what contributes to it, we have to look to the root cause first. What's happened across the industry over the last 5 years in particular is that the industry has responded by asking nurses like Farida to be more resilient, to give them support in that moment. That puts a Band-Aid on it, but it doesn't get at the root cause. And so these issues that you're discussing, whether it be political issues understaffing issues, they all compound the problem. But what I would tell you is the root cause of much of this issue, the layer cake, if you will, of burnout, was baked on the administrative burden that clinicians carry. Nurses spend at least 50% of their time, and primary care physicians spend at least 75% of their time away from taking care of patients and in administrative tasks that Todd and I as lawyers should be spending our time doing, not the uniquely trained clinicians in the country. So we need to look at the root cause of this when we're addressing it, but we need to understand that these are systemic issues, and so in order to attack them, we have to understand how they then impact the individuals.
I want to follow up on your point about what's time consuming when you're taking care of people, right? Because I think so often we think of doctors and nurses interfacing with patients, right? They're, trying to prescribe a medicine or help with a root cause, but so much of it seems like it's paperwork, right? In this world kind of dominated by making sure that you're documenting everything. So Corey, I wanted to follow up with a specific example. Some healthcare professionals seem to prefer a longer shift, which is going to, maybe maximize their time at home or with their family, but sometimes can lead to errors or other issues. How do you work through a problem like that? How do you make that work? And Farida, I want to ask you about that too.
Well, what we know from many of our partners, particularly in the nursing field, is that nurses want flexibility in their schedule, but most hospital systems don't allow for flexible scheduling. I think part of this is incumbent on what Farida said about putting the oxygen mask on first. The healthcare industry needs to turn itself on its head and say, what do the workforce need so that we can create a thriving and sustainable workforce? And that starts with conversations. And the industry needs to adapt to the workforce, not the other way around. And so if individuals want shorter shifts, we need to build the flexibility into the schedules. Now, that said, what you're getting at actually talks about medical errors and patient errors. And there's a lot of data that shows that after a 10-hour shift, there's an increase in the number of hours. But for whatever reason, the industry has not shifted towards moving those numbers down. And then you compound it with a burnt-out workforce, then working extra shifts, and then you're making, you've got error upon error. And nobody who goes into this profession to harm. They always are here to try to improve the lives of others. And so we need to take all of those factors into account when we're redesigning this coal mine, as opposed to asking the canaries, if you will, to be stronger canaries in this redesign process.
That makes a lot of sense. Farida, as a provider, what's your point of view on how to provide that flexibility and to find ways to make sure that people can do these jobs while caring for themselves and their families as well as their patients?
I think I heard you initially say some of us choose these longer hours. And I kind of chuckled because my brother, hopefully he made it here, he's a orthopedic surgery fellow now, but during his residency, I must have saw him, maybe I can count on one hand. I don't know if I've ever seen a resident that chose those hours. Those hours are brutal, inhumane, unacceptable, and it's just part of the rigorous training. So I think choice is it's not the word. It's not a choice. But on the other hand, there are certain providers like nurses and PTs and OTs who choose to work maybe 12 hours as opposed to 8 because then you can take care of your families and you can go to an appointment during the week as well. Or your hospitals do not offer anything less than 12 hours. So you just are placed in that position, and when you have families to take care of, you kind of just go with what's best for yourself and your family. But what can we do? Just like Corey said, we need to put us in the center of conversations that are meant to better our livelihoods. So instead of administrators making rules around the lives of nurses and doctors and all healthcare providers, why don't we have conversations together? That rarely happens. It's more like, this is what you're going to do, this is how it's going to be done, and this is how it's going to work for this organization. I was a travel nurse for many years, so time after time, every single institution that I worked at, it was like about the institution and what rules they have for that particular institution. There was no standardized, there was no let's talk to the nurses, let's talk to the doctors, and everybody was always burnt out.
Right? So you're
That was
finding
standard.
yourself bending to the institution instead of building a plan for care.
Absolutely.
Right.
If I may, I think from the advocacy perspective, that's what we see as a microcosm for what happens in Washington and elsewhere, where the whole healthcare discussion that's been going on, frankly, for generations at this point, are all about payor issues, financial issues, dealing with insurance, trying to protect the institution, certainly trying to protect the patient. And all of these things are important. I'm definitely not here to say that those are not important issues. They are very, very important issues. But there's like no oxygen spent on the people actually providing the care. And there is no healthcare without a cared for healthcare workforce. There is no healthcare. And so it's really a theme of people at the center of the care being taken for granted. And in this discussion, you know, it's you're sort of a second thought is what I think you're describing.
Yeah, and there's this like superhero complex. Like, you can do it. You're a superhero. So, do you ever see a superhero that's showing you when they're down? No. If I'm a superhero, I gotta tough it out and keep going. So I think mentally, we also get in this cycle that I cannot show you my weak point. And most times we catch it when a person is at their lowest. I've been there. I was putting on my smile and cheering my patients on internally. I was burnt out, exhausted, tired, could barely care for myself, but the needs of the patients had to come before mine. And by the time I needed help, I was over. I was just burnt out beyond anybody's. I had to take time off.
And were you able to take that time off?
At that point, I had to choose me. So it was one of those things where I'm like, okay, I have to put myself first.
Yeah.
But then I also always think about those who don't feel like they have that agency to put themselves first, or feel, oh, I'm going to let this institution or my patients down when I'm able to choose myself, because you've been taught and conditioned to be a superhero when we're all human at the end of the day.
Right? Well, jumping off of your point, Farida, I wanted to ask each of you, what is the one thing you've seen that can actually help combat burnout? And you know, you can answer this question from your own perspective, from the perspective of, you know, someone who supports healthcare providers or being an actual provider. Todd, what have you seen work?
Well, getting back to Corey's point around root cause, and I spend my time, and FIG spends a lot of its time in Washington and dealing with these issues politically, and getting to that root cause, there are very, very clear things that are causing the strain. You know, it's workplace violence. Can we keep people safe? Healthcare professionals are 5 times more likely to face an assault than other professions. And so there is a bill that we're supporting in Congress that would make assault against a healthcare professional a federal crime, much in the same way that if you assault a TSA agent, you would be going to jail. That is not the case right now. And so whether it's workplace violence, or whether it's reforming prior authorization, or whether it's making sure that healthcare professionals are paid a fair wage, which I think we all, or maybe not in this room, but a lot of people have this impression that healthcare professionals are living high on the hog and they're very, very wealthy and well off and live cush, comfortable lives, and it just is not the case. They're not living comfortable lives. They're under incredible strain. They're not being paid fairly. Their physical safety is in jeopardy. And yet they're going to work every single day despite that. And so the rest of us tend to forget the problem that exists. But there are real problems and there are solutions that really everyone can support, no matter what side you're on.
You want me? So our foundation did some federal advocacy. We helped create the Dr. Lerner Breen Healthcare Provider Protection Act, which was the first federal law that created programs to support the mental health and well-being of health workers. As part of that, a national education campaign was created by the CDC called the Impact Wellbeing Guide that gave healthcare leaders the steps to redesign this coal mine. And one of the very first things that is the most effective things that organizations can do, and it's in this free guide, and we've turned it into a national program, is to listen to the workforce and ask them what is driving their burnout. That is so critically important because an inpatient nurse and an outpatient nurse, even in the same hospital, may have different things that are causing their burnout. All that said, what the data continues to show pre-pandemic, during the pandemic, now post-pandemic, is that the administrative burden that they carry, heavily influenced by the electronic medical record, is driving their burnout. And so there have been a number of initiatives. We just ran one across all the hospitals in Virginia looking at how you can get at this in different ways. Some of that manifests in nursing alert fatigue, where a nurse is constantly pulled away from the bedside because they're getting buzzed every which way. Who can work in that kind of a domain? That's why I don't wear an Apple Watch anymore, right? Sorry if Apple's here, right? Like, I just keep getting buzzed. Or the ambient listening for using artificial intelligence to document the notes so that the clinician can be present and actually engage in a conversation and listen to Farida's needs, not thinking about, oh, I have to fill this field out and did I get her age and all of those things. So there are some really concrete things, but it all starts with listening to the workforce and asking them what is driving their burnout. And that part of the conversation has been missing in healthcare.
I think that's a great lesson. Farida, what would you add?
Yeah, I would say it's so many. It's like a tree with so many branches, and we are at the root of it. So it could be either safety, like Todd just mentioned, provider safety. I've been a victim of workforce violence, and it's, so-and-so is manic, so that's just part of who they are, versus, oh my gosh, how can we protect you? So imagine going to work and being a victim of violence and then working long hours and then feeling inadequately paid. And on top of that, just dealing with, when you're working with patients, these are not machines. These are real humans with real problems. So you're constantly taking in what they have going on and also giving output. So there's a high stress. And if you're in the ICU and the patients are very critical, that's added stress. So back to Corey's point, it's really so many branches, but for us here, we're tackling a few at a time. So we want to focus on mental health, how to protect the mental health of our providers, to create that thriving workforce. We want to focus on safety. How do we keep us safe? We did not go to work to be abused physically, mentally, and we also want to be adequately compensated. We just mentioned the average shift is about at least 12 to 14 hours. Some people are working 24 hours. I don't know anybody that wants to work 24 hours and not get paid. So all of these are part of this tree, and it goes deep and it goes wide. But we can start at least these three. I think we are making a step forward. Yeah.
And I do think, events like this are so fantastic because they do help shine a light on these issues. And there's 21 million healthcare professionals in this country. I think there's 115 million across the world. We all know healthcare professionals. Almost all of us have a friend or a family member who's a healthcare professional. I would encourage all of you to ask your family members who are healthcare professionals, or if you guys already know all these issues, ask your other family members to ask other family members about these issues, and create a conversation about this, because ultimately we need to make this a kitchen, dining room table topic of conversation where people actually understand that these problems are real, they're happening, they're going to affect all of us in this country if we don't address them, because there's not going to be healthcare for the rest of us if we don't. And so we really need to shine a light on them and bring these issues up for real discussion.
That was
Credit
great.
to you for making that happen today.
Thank you for being here with us. We appreciate it. Before we end, Corey, I wanted to return to something that you brought up. The Dr. Lorna Breen Healthcare Provider Protection Act was a breakthrough for mental health care access, but it expired around this time last year. What is at stake if Congress does not reauthorize this act?
So the Lorna Breen Act was the first step in a whole staircase of policy that we intend to build to support the healthcare workforce. It created two sets of programs. A pilot set of 45 hospitals across the country received grants to support their workforce. Those grants were administered by HRSA, and those grants have all expired. And so many of those programs, including programs in this great city, are being dismantled because of the lack of funding. In addition to that, as I mentioned before, this healthcare leader training guide, where we as a foundation have been pulling up the mantle and doing private fundraising to help scale the implementation of it. What's at stake is what Todd just said, the healthcare workforce. We need a thriving and sustainable healthcare workforce, and the Lorna Breen Act is the first way for us to begin to rebuild that, and we have a much longer way to go in doing so. Luckily, it has very strong bipartisan support in both the House and the Senate. That's the way we began this journey. It has the support of over 75 national associations in all professions in healthcare. So it's not a question of a controversial piece of legislation at all. And things are slow in Washington right now. And so we've got to make that push to get it back on the conversation so that these organizations can build upon the great work that they already began and then scale that across the industry.
Great, thank you. Well, that's unfortunately all the time we have. I want to thank each of you for your time today. Thank you so much for shining a light on all of these important issues. Thanks again.
Thank you for having us.
Thank you so much.